So we're going to go ahead and get started really quick. Thank you for joining us this evening. My name is Katie Harden, and I'm going to be one of your panelists this evening. Tonight's focus, we just have 30 minutes. We have a lot of questions we're going to try to get through in the time that we have available. We will have Q&A open. If you have additional questions that we are not able to cover, feel free to post them there. We have a number of our Council on Residency Placement members, our CORP members, that are also joining us this evening, and we'll be trying to answer all of your Q&A questions there instead of us doing that live, since we have so many that we plan on going through this evening. So just our agenda for tonight, both of us will introduce ourselves real quick, and then we're going to go over fielding interview offers, scheduling interviews, and then just real quick at the very end, go over the schedule for our 2 remaining sessions that we have coming up for the series. So this session is currently being recorded. It will be posted to the CORP website within the next couple of days, as well as those of you that registered for the event, you're here. You'll also receive an email with a link to access the recording after as well. Since this is a webinar format, you are in listen-only mode, so your cameras and your microphones do not work. So if you do have any kind of questions, post them in the Q&A. Any technical issues, obviously, send that in the chat, and our team will help you with that as quickly as they can. And like I said, our other CORP members are going to be fielding all of those Q&A questions. So as I said, my name is Katie Harden. I am a residency placement coordinator with Kansas City University. I am based on the Joplin campus. Dr. Davis, do you want to introduce yourself real quick?
Okay, perfect. Hello, everybody. I'm Dr. Marissa Dibus. I am a current emergency medicine resident, first year at University of Illinois College of Medicine in Peoria, Illinois. And I'm a graduate from Nova Southeastern University College of Osteopathic Medicine, Fort Lauderdale campus. It's a pleasure to be with you all. And I hope we can answer all your questions and hopefully make the residency interview process a lot more fun.
All right, so one of the first questions with ARIS opening up to programs today that a lot of students are asking is, when should I expect to start receiving my interview offers? The first thing that's really important for you to know is that there are some specialties that have established universal interview offer dates, meaning that they have specific dates identified that they want and ask that their programs within their specialty release their interview offers. So if you're applying to the specialties that you see on the screen, the date next to it is the date that their specialty has advised that they release their interview offers. I'll be honest, the majority of these programs, I think, especially neurosurgery, ophthalmology, OB-GYN, surgery, urology, thoracic surgery, dermatology, ENT, plastic surgery, and ortho, they're all very consistent in following the dates. Emergency medicine, you'll notice there's only 30 programs that have made that decision to participate in that universal, because so many programs last year did not. And so if you see a specialty not on this list, to be honest, anticipate getting interview offers any moment, any day now, because programs can access and review your application. I know I've already heard from a number of my own students already today that are already getting some interview offers. Interview offers, though, will be going out throughout the next few months. The bulk of them tend to go out in the month of October for those that are not on this list. Some will go out in November as well. But there's also some that trickle in December and January, especially if you get waitlisted and if a program has any slots that open up for you. So, Dr. Dibus, how did you receive your interview offers when you went through this cycle? How can these students expect to possibly receive them? What kind of platform or format did you get yours?
So that's a great question. Primarily, you'll be receiving them through a few different online portals. In my experience last year, most of my interview offers came directly from AAMC. So when you're on ERAS and you go through your inbox, you will see the invitation, and then that gives you a link where you can schedule your interview, and it shows up on that ERAS calendar. However, there are a lot of popular third-party interview scheduling apps that you should definitely be aware of. So if you haven't heard of these prior, so in addition to the ERAS or AMC that I mentioned, there is Interview Broker, there is Thalamus, And then there's also Third Friday. That's primarily used by if you apply to an HCA hospital. And then sometimes you will receive emails from the residency program coordinators themselves. So that is my experience. So those
So
are
Dr.
the few
Divas,
that
real quick though, when I know that a lot of these all use a portal, but did you receive a notification that you had an offer within the portal via email? And then you clicked
yes.
on the link to log into that portal or set up an account with that portal? Okay.
Yep,
So
exactly.
whatever email address they have established in their ARIS application is the method that they'll at least get initial communication to log in to schedule.
Correct.
Okay, awesome.
Although I would create an account before those interviews start coming in. That way, when you get the invitation, you're not freaking out, thinking all the spots are going to go up just because you took a couple extra minutes to set up your account. So I would do that, and also favorite or VIP the email addresses. So like no reply at aamc.org, no reply at Thalamus, VIP those, and then you'll get like because that was my strategy. And then you get like a weird ringtone that comes on that that's an interview invite. So you open it and then schedule accordingly.
And one thing to be mindful, is the next question: how quickly should we respond to these interview offers? The guidance from AAMC is that they ask programs, number one, do not offer more interview offers. Don't send out more than you have slots available. So if a program has 100 interview slots available, they're only to send out 100 interview offers. Now, I'm just throwing a number out there for the sake of the moment. And so they are not to offer any more until someone has declined and they have a slot open up again. And so that's the guidance. So knowing that, something's changed a lot over the last few years, and you actually, they say give these students 24 to 48 hours to respond. It used to be it was first come first serve as quickly as you could, and the timing is a bit different. Dr. Davis, was that kind of your experience last year, that it wasn't that mad rush? Yes, you want to respond, but it's not that you have to drop everything and keep your phone right by you like it used to be.
I think it kind of depends. I did have some experiences where I was actually driving to a journal club. I heard that little tone and I'm like, shoot, well, I am not going to do that while I'm driving. So I got to where I was going and noticed that all of the interview dates were taken off. Granted, some people will cancel, and sometimes some program coordinators have received interviews where I was like, hey, you didn't give a lot of dates. I was really interested in this program, but you just gave me this email today and there's no more spots. Are you considering to open more dates? There's no harm in asking a program coordinator in email, professionally. And then to my surprise, that program actually opened up more dates. So I was able to schedule because that was a program I was interested in. But that is, so I would not say, if you are on rotation, if you're with a patient, if you're with your team, don't run away and necessarily get the phone. Granted, most people in the hospital that you're going to be rotating with, residents and attendings, they certainly remember what it was like during the interview process. So if you just say, hi, I got an interview invitation, do you mind if I just step away for just a couple minutes? They're most places are going to be pretty understanding. If you are scrubbed in the middle of a surgery, obviously don't do that.
So how much notice did you receive when it came to the interview being offered and when it needed to be scheduled, the date of it being scheduled for? What was kind of the timing, just to help these students kind of know what to expect?
I did start getting interviews kind of around that late September time, right when I submitted my application. And then the earliest dates were usually, for me, I applied emergency medicine. So those dates were like starting to be mid-October and onward into January,
So you
February.
had a few weeks. And I will tell you guys, I think that's been the experience for a lot of my students as well. The only situation that I saw students get interview offers last minute was late in the season when they had been waitlisted, and the program said, hey, we had a cancellation for tomorrow. Is there any way you're able to interview tomorrow? And so that just happened, you know, for some students, but you already know you're waitlisted with that program. And it was always later in the season. But yeah, a lot of our students, it was several weeks notice at least. You'll find a lot of the bulk of your interviews will be scheduled for late October into November and December. November and December, I think, for most specialties are the heavier months. So I know you had some situations where you were offered multiple dates. What advice, Dr. Dibus, do you have and how a student should decide the timing of that interview when one program gave them multiple date options?
Absolutely. So usually, while I know this may not apply for everyone, if you have already received the schedule of you, wherever you're rotating for that month, knowing that schedule and then being able to kind of, you know, work accordingly. With EM, we work primarily in shifts, so I would schedule my interviews on dates where I didn't have a shift. However, most audition rotations or elective rotations are very understanding, and usually they'll kind of include in their orientation information or information you need to know before you start what their stance is on, you know, how many days off you can have for interviews. So they're pretty good about they're very responsive about that because they're very understanding. So that's not something I had an issue with. I think just making sure that it's a day and time that you know that you aren't going to be able to work on that, you're not working on that day, and you're able to schedule that in advance and that you can prepare accordingly.
So as an advisor, I do want to tell you all, it is very important, two things. Number one, you need to know what your school policy is about attendance. Be mindful and aware of that and make sure you're following your school attendance policy, but also in advance of starting your rotations, be aware of what the attendance requirements are for those rotations. Because like Dr. Dibus implied, one of the things that the last thing you want to do, and I will tell you, I had a student this happened to last year. Student did not find out what attendance requirements were prior to starting the rotation. Started the rotation on the first day of the month, got 7 interview offers and confirmed and scheduled 7 interviews for the month of December. Started the rotation. They had done that in advance. Start the rotation, find out, hey, by the way, you can only miss 4 days this month. The student had to go back and cancel 3 interviews because they could not jeopardize, because the program was one of their top programs. So you don't want to risk failing a rotation because of too many missed days, and you don't want to risk having to cancel. So when you're offered multiple dates, if you know you're going to be on elective rotation, has a lot more flexibility, you want to try to schedule it during that month. If you know that you're given multiple dates and this rotation, this audition is only going to really restrict you in how many days you can miss, you want to maybe try, and you're given optional other dates that don't fall in that month, go ahead and schedule one of the other months, because there are going to be some programs that will only give you 1 or 2 dates and they all fall in the same month. And so not every program gives you multiple date options. So just something as an advisor, quick to just kind of be aware of. So what about when those interview the invitations overlap? The dates, you know, 2 programs give you an offer for the same date and you only get one. Dr. Dibus, how did you handle that as a student?
Absolutely. So as far as the interview dates, whether it was like they overlapped or conflicted, because you're definitely going to have a lot of those. A lot of programs tend to kind of interview especially the middle of the week. If you do have enough time to reschedule and you know you have a flexible rotation that may allow that, I would say if it's like at least a month prior to your interview, you can go ahead and reschedule. So that's one thing that I did. Also be able to pay close attention to what time. Sometimes they will show the interview schedule with your invitation. So saying, let's say you have an AM versus a PM option. If you're able to pick one time over another, that may work for your schedule. Or let's say you're not allowed to miss that rotation day, but you can come, like, can I have my interview in the morning and then come in the afternoon to your rotation? That's something you can do as well.
All right. So is there a best strategy for prioritizing interview scheduling? Which interviews to schedule first, in the middle, or later in the season in terms of your top choice programs versus programs lower on your list? Dr. Dibus, what was your how did you prioritize, or did you even prioritize the timing of scheduling based upon where they were on your list?
So kind of what you were mentioning about picking a rotation that's going to be more flexible toward the peak season months, so that way you're able to schedule more of your interviews then. I put more of my top programs that I was very interested in that month. Another tip that I did, which because just looking, I don't know if there's data to support this, but in my experience and experience of other residents that graduated with me, whether it's the first interview on your list or the last interview, that I don't think the order of when you have the interview has a real impact on where you match, rather than, your rank list and the strength of your interview. Would you agree with that?
Absolutely. I was going to say, honestly, the timing of within the season of you performing those interviews doesn't matter. You want to make a lasting impression, because these programs are going to go back and meet as a team, as a committee, and review all of the applicants they interviewed, review all their notes on everybody all together, and discuss how to rank everybody. And so the timing there isn't some magic time, whether it be early in the season or late. And I think that's important for students to understand, is you just want to make sure it's in a time within your schedule that allows you the best time to focus on it, to not jeopardize rotations, and not miss critical time, and be able to do well during the interview. As far as how far apart to schedule interviews, honestly, there's not some magic time. Again, it goes back to make sure you're following your attendance requirements for the rotation. Is it possible to schedule more than one interview on a day? Technically, yeah. I did have some students in the past that they're like, hey, I've got one program in the morning and one in the evening, or I may have a meet and greet thing with the residents in the evening, and then I've got, another program in the afternoon. So you do have the ability that a lot of the programs are very specific in the time frame that they need you to be available. I will be honest though, there are some programs that aren't, and they just say it'll be this day, we'll send you more details later. So unfortunately, in those situations, you do end up needing to block out the entire day until you have more specific details provided to you by the program. So how can we best navigate interviews with rotation schedules? We kind of already covered that, so we'll kind of skip past that. How many interviews is a safe number to accept, and how many is too many?
Okay, so
go for it.
So I'll answer this part objectively. If you look at the NRMP data of USDO seniors, I kind of looked through this data myself. I would say statistically speaking, with having, based on that data, a 95+% of matching, it's 15 to 20.
But that's specialty specific, though. I will say that. So I think that's really important to understand, guys, so NRMP charting outcomes does have data they've published, and it is very specialty specific. They have a chart that it's a graph that shows it's labeled contiguous ranks. How many contiguous ranks do you have in the likelihood of matching? So for instance, family medicine, if you want an 80% chance of matching family med, you only need 4 interviews. If you want a 90% chance of matching family med, you only need 6. And so, but every specialty, you're much more competitive specialties, it's 7 and 12 or 8 and 10. It just depends on the specialty. So strongly advise you to look at that data. It'll help you gauge your likelihood of matching. That's something we tell our students. We really want our students to focus on trying to hit that at least 80% chance. At least that's the minimum we want to see them at for their specialty that they're specifically applying to. So I think if you haven't already done that, look at the NRMP charting outcomes data, and the last set is from 2022 class. So it's not horribly old. So definitely check that out. Now, once you get to a point, you're going to have so many interviews, you have to decide whether or not you should start declining, or do you keep accepting interviews? Dr. Dibus, did you run into that situation where you had to, like, you were getting too many on your list?
Yes. So, but sorry, I was going to mention it is specialty specific, like you were saying. I just wanted to provide, based on all the data I read, like here's a generic number just to make it easy to remember. So I do apologize if that came off as misleading to anybody. So as far as whether or not you want to decline an interview, interview fatigue is very real, especially with especially with COVID and everything, how we're often on Zoom, and that can be a lot. I would say, let's say you did not match. Is it worth, like, I would rather not match than interview at this program. Please cancel it. Because then you're taking out a few hours of your day with a program that you have no interest in. And that interview could have gone to someone else who is interested in that program. So I would say that's a good benchmark to decide. Also, if if that program doesn't offer nearly as many benefits, like for example, I don't want to be that far from family and you live in New York, you don't necessarily have to, then cancel the one in Nevada unless you really, really are interested in it. Those are, I think, just really thinking about what you want out of the program and what experience you want in your training is going to be a big factor. And I can't answer that for you. That's going to be strictly what you feel in your heart, to not be too corny, but like what you really strongly feel like, what I want my program. And if that program doesn't have what you want, don't waste your time.
Yeah. And so I know we don't have a whole lot of time, so we're going to try to run through these next questions quickly. If the program is only scheduling virtual interviews, is it okay to ask to come on site for the interview if I'm close by? You can ask. Be prepared. There will be a lot of programs that, yes, they'll say, oh yeah, we didn't know you were in town or local. Yeah, we'll be happy to have you. But there are going to be others that are going to want to stay consistent with the platform of virtual interviews to ensure there's not a bias. And so they may say, no, actually, we're going to keep it virtual. So don't be offended if they say no. But you can absolutely offer and let them know that you are actually nearby and are available in person if that's something that's feasible. So what is the best way to respond to and manage in-person interviews while on audition rotations? Dr. Dibus, you already kind of touched on that on how to ask to step away. So I think we're good on that. What is the appropriate way? Oh yeah, sorry, go ahead.
Yeah, just be kind and professional. They're very understanding. And if you don't mind, I'd like to piggyback on the past question. There are seconds for people that want to, if you want to visit a site in person. In addition, you do not have to visit that place on that one scheduled day. You can email the program coordinator and say, hey, I had a wonderful experience with your interview. I'm so interested in your program. Can I come by on one of your didactic days or conferences? Or maybe if I could come on a separate day, would that be acceptable? And usually they're really enthusiastic because they want you to like their program. And they're like, and that's how I got to see some programs where I got to go to a sim day. And that was a lot of fun. So, and it gives you perspective on, hey, can I see myself working here? Because you're really part of it on a day where everybody's doing their thing.
So what is the appropriate way to reach out to programs if you miss an email or a deadline? Did you run into that at all, Dr. Dibus, where you didn't get to it in time?
So I did run into an incident where the some of the information for the interview was in my spam folder. So for one, check your spam folder, but that happened and then I actually wound up calling the program coordinator and I said, hi, I have an interview with you Monday morning. I'm calling them on a Friday afternoon. I still have not received this information. If you could email me back at your earliest convenience or call me, that would be greatly appreciated. And it turned out she'd sent everything 2 days ago. So that was something that I think, again, things like this happen all the time, more often than I think people talk about. So I would just say, be honest if there was a reason to access the information, and then be able, if let's say you did miss an interview date or something like that, usually if you're able to reschedule or cancel, you can handle that with the program coordinator. But again, be
Own
kind
it. Yep.
and
Own it and apologize. That's the number one rule of thumb when you communicate with them. Once you realize the error or mistake on your part, if it was on your part, make sure you own it, you apologize for it, and ask if it's a possibility to reschedule if by chance you did miss. And it does happen sometimes. So, okay, so what do you do if you accept an interview offer from one program, but then receive an offer from this for the same date from a program that's higher on your list? Dr. Dibus, I know you experienced that. So how did you navigate that kind of scenario?
okay, so when it comes to rescheduling a lot of interviews, if it is more than a month out, and granted, a lot of these these interviews, they're using online, platforms where you're tapping what date and time you want to schedule the interview. You can usually just change it electronically. And if it's several months in advance, then by that point, the program coordinators, they're not preparing your interview or sending you information. So it's not a huge issue. So you could just change it and then rechange it in your ERAS calendar. If it is a month out or less, or like 3 weeks out, and you would like to reschedule or cancel, that's the latest you should be canceling an interview, in my opinion. So I would then just say, hi, thank you so much for this wonderful opportunity. And I was very excited to get to know your program, but I cannot do it at this date due to, when something came up. You don't have to say why you're rescheduling or canceling the interview, but I'm afraid I have to reschedule. Is there another date that is available? Thank you. Or I'm afraid I have to cancel. Thank you so much for the opportunity. And that's pretty much it. Just have a nice, concise, professional, kind email. I know I'm kind of saying that a lot, but as long
that's
as you're
important.
just
How you communicate with these programs is so critical. So when you cancel, like Dr. Dibus talked about earlier, there are many different platforms that they are using. Go ahead and not only cancel your interview within the platform that they use, but also contact the program directly via email or phone call. I'll be honest, if it's within the next few days, you need to try to call them. If it's not within the next few days, email is sufficient, but make sure, and like she said, you don't need to provide an explanation if you're 2 weeks out. I'll be honest, if you're less than 2 weeks, you need to provide a reason for why you're canceling, because it is deemed unprofessional. And they can actually report it to NRMP for unprofessionalism. If it's an emergency, which I will tell you, that's happened. Students get car accidents, they get sick. Go ahead and share with them the nature of your emergency. You don't have to give them the details, but at least do that, especially if you're canceling very last minute on them. And I'll be honest, a lot of these programs in those situations, they're like, we're so sorry, we'll connect when you're able to, and let's reschedule. So they're usually very willing to reschedule in those kinds of scenarios. But it's important that you be professional, that you communicate very well and effectively with these programs, and they'll be happy to work with you. So you've kind of already gone over those next two bullets, Dr. Dibus, and the best etiquette and communication with them. So the last question, if I cancel an interview, does it reflect poorly on more people than just myself, such as my school or DO students in general? The answer to that is it can, if you do so very unprofessionally. If you cancel last minute, you don't give appropriate notice, things like that, it definitely reflects on your school. Not necessarily what I say it's so much on DO students in general, but definitely on your school, because they're going to assume that it's a reflection of how you were taught to handle the situations within your school. Dr. Dibus, do you have anything else quick to add? I know we're out of time.
say exactly what you said. If you cancel too last minute, except for the ones that, because early, like let's say later in the interview season, I did not get a waitlist notification. I got an email, I think January 20th, like, hey, would you like to interview for our program? And their dates were January 22nd and 24th. So that will happen. And then then of course you can, but then answer professionally, but do not think that your school is it's gonna be looked down upon because they're not giving you notes themselves. So
Yeah, and you're not canceling that interview, you're just declining an offer. So like, I'm so sorry, I can't make that work. Yeah, they understand in those. So real quick, because we are out of time. So we do have 2 additional webinars coming up that are on interviewing. So in our 3-part series, so we've got one tomorrow evening at 7 p.m. Eastern, and then Monday night at 7 p.m. Eastern. So tomorrow night, it's interview day. What now? That's the topic. And then on Monday night, they're going to do a Q&A session. So a lot of the questions that, if there were any questions in the Q&A they weren't able to get to this evening, we'll try to cover those that night and go over some other interview components and next steps to kind of help you all. So we thank you all for attending and have a great evening.